Welcome to a deep dive into the world of depression. You've sent us some really interesting articles for this one. Some of them are kind of laying the groundwork, and then others are looking at it, on a global scale. It seems like you're interested in understanding not just what depression is, but uh, how it affects people all over the world.
Yeah, that's a really important perspective to take. Depression's impact, it goes way beyond just individual experiences. It really is a worldwide thing.
Right. And speaking of worldwide, one of the articles said that something like 5% of adults all over the globe have depression. That's going to be millions and millions of people.
Oh, yeah, absolutely. And to really get how big of a deal this is, you have to understand that depression is a leading cause of suicide. The World Health Organization says that's over 700,000 deaths every single year.
That's really heavy. It definitely shows how important it is to understand and deal with this issue. So let's start with, like, what is depression actually? I know it's more than just like feeling sad or down, but how do you actually define it in a way that really captures everything about it?
Well, the World Health Organization, they describe depression as a black dog that's always following you around. I think it's a pretty powerful way to describe it. It really shows how persistent and just heavy depression can feel. It's not just like you're sad for a bit, it's a mood disorder that affects your thoughts, your behavior, your physical health, and of course, your emotions.
Okay, so it's like this black dog that's always there, and it affects all these different parts of your life. And you mentioned that there are different types of depression. Can you talk about that a bit more? What are some of the different types we should know about?
Sure. There are the ones you hear about more often, like major depressive disorder, which is when you have, those really intense periods of sadness and you lose interest in things. And then there's persistent depressive disorder, which is kind of like a long-term low-grade depression that sticks around for a long time. But I think you might find some of the less common types really interesting, like atypical depression, which can be hard to diagnose.
What makes atypical depression so different?
Well, people with atypical depression, they can actually feel their mood lift temporarily when something good happens, which, seems like it wouldn't go with depression.
So it's like there's a little bit of hope that shows through, but the depression is still the main thing.
Exactly. It makes it harder to figure out what's going on and shows how different depression can be for different people. And then there are times when hormones and like big life changes play a big role, like with prenatal and postpartum depression. It really shows that there isn't always one specific cause for depression. It can be a bunch of things all mixed together.
That makes sense. So talking about those different factors, what are some of the main things that researchers have found that cause depression? It seems like there's no one simple answer, right?
You're right, there isn't. It's really complicated, and while we've learned a lot, there's still a lot we don't know. One big piece of the puzzle is brain chemistry. Neurotransmitters, especially serotonin and dopamine, they're really important for controlling mood. When those chemicals aren't balanced, it can lead to depression.
So it's like the brain's communication system is having a bad day.
Yeah, that's a good way to put it. And then genetics are a factor too. If you have a close family member who has depression, you're more likely to have it yourself. It's not a sure thing, but it does mean you could be more prone to it.
So genes kind of set the stage, and then what happens in your life comes into play.
Exactly. Things that happen in your life, like losing your job, grieving, or experiencing trauma, those can all be triggers, especially for people who are already genetically predisposed. But it doesn't have to be big, dramatic events. Chronic stress, like difficult relationships, or even just money problems, those can contribute too.
It's like the straw that breaks the camel's back, but sometimes the straw is actually a bunch of smaller things that just build up.
Right. And we can't forget about how the mind and body connect. Things like chronic pain, illness, and even some medications, those can also contribute to depression. It really shows how connected our physical and mental health are.
Wow, it's amazing how all these different causes, from like drain stuff to your genes to what happens in your life, how they all come together. It really makes you see that depression isn't just something you can, snap out of, like some people might say.
Yeah, it's definitely more complicated than that. But even with all that complexity, there's good news. Depression is treatable and people can absolutely recover.
That's good to hear. So before we talk about treatments, let's talk about diagnosis. How do doctors figure out if someone actually has depression?
Well, they start by really listening to you and asking about your symptoms and your medical history. They'll ask about things like your mood, your sleep, energy levels, appetite, how you've been thinking, that kind of thing. They want to get a sense of how long you've been feeling this way and how bad it is to see if it fits the criteria for depression.
So it's about getting the whole picture of what the person's going through.
Exactly. And sometimes they might even do some blood work to rule out other medical conditions that could be causing those symptoms.
That makes sense. Make sure they're treating the right thing. So what happens if someone is diagnosed with depression? What are their options?
Well, there are a lot of different treatments that work, and the best one really depends on the person and how bad their depression is.
So it's not like a one-size-fits-all kind of thing.
Nope, not at all. One of the most common and effective treatments is psychotherapy, talk therapy. There are different types of therapy, but a lot of them focus on helping you understand your thoughts and feelings and learn new ways to cope with them.
What about medication? When does that come into the picture?
Well, antidepressants are often prescribed to help, get those brain chemicals we talked about before, serotonin and dopamine, back in balance. They can really help a lot of people, but it's important to know that they don't work for everyone, and sometimes it takes a while for them to really start working.
I've heard that antidepressants can have side effects. Is that something people should be worried about?
It's definitely something to talk to your doctor about. Some people do get side effects, but a lot of times those go away after a while. If they stick around or get to be too much, your doctor might change your dose or try a different medication.
So finding the right medication and the right dose can be kind of a process. What's important for people to know about starting antidepressants?
Well, one thing to keep in mind is that antidepressants aren't a quick fix. They work best when you combine them with therapy and make changes to your lifestyle. The medication can help with the symptoms, but therapy gives you the tools and strategies to really deal with the root causes of the depression.
So it's like a team effort, medication and therapy working together.
Exactly. And while we're talking about teamwork, we should also mention complementary medicine. These are things you can do along with traditional treatments like acupuncture, massage, even yoga or meditation. Those can be really helpful, especially for people with mild depression or if you just want to improve your overall well-being.
So it's about taking care of your whole self, not just focusing on one thing.
Right. And for really severe cases of depression, the kind that hasn't gotten better with other treatments, there's something called brain stimulation therapy.
I've heard a bit about those. What can you tell us about them?
Well, there are a few different types, and they all work a little differently. Electroconvulsive therapy, or ECT, has been around for a while, but there are some newer options, like transcranial magnetic stimulation, TMS, and vagus nerve stimulation, VNS, that are showing a lot of promise and usually have fewer side effects.
So they're kind of like rebooting the brain circuits.
Yeah, that's a good way to think about it. They work by directly stimulating certain parts of the brain, and even though they're usually used for more serious cases, they can be really helpful for some people.
It's amazing how many different ways there are to treat depression. It gives me hope that people can find what works best for them. And even when you're working with a doctor, there's still a lot you can do yourself to manage your mental health, right?
Absolutely. Having the right tools and taking care of yourself can make a huge difference.
So, talking about self-care, what are some things people can do every day to, fight those depression symptoms and feel better mentally?
A lot of them are things that are good for your overall health, too. Regular exercise is a great mood booster. Even doing something moderately active can get those endorphins going and make you feel better.
I totally agree. I always feel better after a good workout. What about sleep? I'm guessing that's important too.
Sleep is super important. Both how well you sleep and how much you sleep can really affect your mood. Having a regular sleep schedule and making sure your bedroom is a relaxing place can help a lot.
Yeah, that makes sense. Setting yourself up for good sleep. And how about food? Does that play a role too?
It definitely does. Eating healthy foods like fruits, vegetables, lean proteins, and whole grains can really make a difference in how you feel. And on the other hand, cutting back on processed foods, sugary drinks, and too much caffeine can help keep your energy levels stable and prevent those mood swings.
It all goes back to that connection between the mind and body we were talking about before.
Exactly. And another important thing is social connection. Spending time with people you care about, having meaningful conversations, feeling like you belong, those things can be so good for your mental health.
It's easy to isolate yourself when you're not feeling good, but reaching out to people can really help, even if it's hard at first.
That's true. Sometimes just going for a walk with a friend or talking to someone on the phone can change your whole perspective. And of course, if you're feeling overwhelmed or thinking about hurting yourself, please reach out for professional help right away. There are resources like the 988 Suicide and Crisis Lifeline that are there for you 24/7.
Absolutely. There's nothing wrong with asking for help. It actually shows strength and that you care about yourself.
I couldn't agree more.
So we've talked about a lot today. Different types of depression, what causes it, how it's diagnosed, and all sorts of treatments, both traditional and complementary. And the important thing is that recovery is possible. It's a message of hope that everyone should hear. But it's not just about, like, what individuals go through, right?
Wow.
We talked about how depression is a global thing, and some of the articles talk about how some people all over the world don't have very good access to mental health care.
Yeah, that's a really important point. The kind of help that's available can be totally different depending on where you are in the world. It really shows how we need to work together as a global community to address this.
And it's interesting, like, even though there are those differences, all of the sources talked about how knowledge and awareness can help break down the stigma around mental health and give people the power to, take control. It seems like people are really trying to make it more normal to talk about mental health, just like we talk about physical health.
Totally. Getting rid of that stigma is so important. It helps people feel more comfortable asking for help and supporting others who are struggling.
Right. It's like that saying, what's whispered in the shadows loses its power when spoken in the light.
That's a great way to put it. Talking about these things openly can really change things, both for individuals and for whole communities.
So we've talked about how depression affects the world,
Hmm.
all the different things that cause it, how it's diagnosed, and all the different ways to treat it and recover. But before we finish up, is there anything else from these articles that you think our listener should take away from this deep dive?
One thing that really stuck with me was from the Cleveland Clinic article. It said that some medications, the kind that are supposed to treat other health problems, can actually cause depression as a side effect.
Oh, wow, that's really interesting. So it's like you're trying to get better, but the treatment itself could be making things worse.
Yeah, it just shows you how connected everything is in our bodies, both physically and mentally. It's a good reminder to always be open with your doctor. Ask those questions, even if they're tough, to make sure you're getting the best care possible.
So it's about being proactive, speaking up for yourself, and understanding that getting better is often a team effort.
That's a great way to sum it up. Knowing about depression and being aware of it, those are really powerful tools for dealing with it, both for individuals and for all of us.
Well said. This has been a really eye-opening deep dive, and I hope it's helped our listener understand depression better and given them some hope.
Me too. And to anyone listening who might be going through this, remember you're not alone. There is help out there, and you can get better.
And on that note, we'll wrap up our deep dive into the world of depression. Keep learning and stay curious.